Hi, my name is Samantha Simonetti. I'm a student physical therapist here at Campbell University, and today I will be performing the Kim Test, as well as giving you an explanation as to what the Kim Test is. So the Kim Test is used during an evaluation of the patient's labrum when suspecting instability or tear to the structure. The labrum is a circular dome of fibrocartilage that attaches to the glenoid of the scapula and allows for proper alignment of the head of the humerus. So here I have the bone of the scapula, and you can see the glenoid is the articulating surface for the humerus. The fibrocartilage that I'm describing, the labrum, attaches to the rim of the glenoid and allows for that placement to occur. It's a stabilizing structure there. So if there is a lesion or tear to that area, it prevents the proper alignment of the humeral head and sometimes reproduces pain, as well as clicking or popping of the humerus during motion of the shoulder. So the Kim Test itself, we are going to be placing the patient in 90 degrees of abduction, as well as a 45 diagonal motion of elevation, and then providing an axial load into the shoulder. These things are going to stress particularly the labrum to see if we have any reproduction of pain. So, as I was explaining those different steps, the posterior inferior portion of the labrum is exactly what we'll be stressing in this case. I'm going to start by explaining step by step how you would perform this test. The first thing I'm going to explain is the patient position. So Phil here will be my patient. We're going to perform this test with the patient in a seated position with 90 degrees of abduction of the affected arm. Whenever performing this test, you would start by assessing the patient's unaffected side first, and then moving on to the affected side. To save time today, we are only going to be performing on the affected side. So we are going to place, like I said, the patient into that 90 degrees, and then you're going to actually put them in the 40 degrees of elevation in a diagonal motion. Then you're going to place your hands, one being at the elbow, the other being at the shoulder. You want to make sure that you're in line with the force that you're going to provide. So I'm going to change my body mechanics here. You're going to create an axial load through the humerus into the shoulder joint. So you're going to start with that patient in that 90 and 45, and then place them through the motion, as well as creating that axial load. You're looking for reproduction of pain, as well as any clicking or popping, but the reproduction of pain will be your positive findings. I'm going to show you one other way of performing this test with the patient position in supine. In this case, once again, you want to make sure that your body mechanics are in a way that you can provide a force through the shoulder joint in that posterior inferior way. So here I'm going to make sure that he's once again at that 90 degrees of abduction. I'm going to keep the same hand positioning, one hand at the elbow and one hand at the shoulder. Okay? And here I'm going to force through the shoulder. I'm putting my weight through. And in this case, I'm actually able to provide more force through the labrum and in this position, as well as you're stabilizing the patient by having them lay on the surface of the table. So I'll have you go ahead and sit up for me, Phil. The next thing I'm going to do is provide an explanation to the patient. So in this case, Phil, because you are having pain of your shoulder, I'm actually going to perform a series of tests to check the stability of your shoulder. This test is the Kim Test, where I will actually be compressing structures of your shoulder and actually looking at the lining of the joint itself and seeing if you have any popping, clicking, or abnormal movement of the humerus, and if you have any reproduction of your pain. If you do have reproduction of your pain, I can tell that you might have a lesion to the area. So the last thing I'm going to do is show you once again how to perform the test, as well as the scientific findings. So we're going to start once again with the patient in the seated position. We're going to get into that abduction and 45-degree angle. Place the hands properly. Make sure you're in a position that allows for force in the posterior inferior direction of the capsule. And create that motion. Looking for any reproduction of pain. So in this case, the scientific findings are that the sensitivity is actually at 80% and the specificity is at 94%. These findings were actually found in a Kim article, in which case they were comparing the jerk test to the Kim test. The jerk test was sensitive in finding lesions of the posterior joint capsule, or labrum, and the Kim is actually sensitive for inferior lesions of the labrum. Both of those were found in the Dutton Orthopedic Examination book. And that will be all for today.